What is the reason of heart attack? The number one risk factor cardiologists never discuss. Most people think the reason of heart attack is simple: high cholesterol, blocked arteries, too much fat in your diet. But what if I told you that's not the full story? What is the reason of heart attack that cardiologists never discuss? It's something silent, invisible, and far more dangerous than cholesterol itself. When I first discovered this, I realized I'd been ignoring the real cause all along. For years, I believed that lowering cholesterol alone could prevent heart disease. But the truth is, millions of people suffer heart attacks even with normal cholesterol levels. The real causes of heart attack often hide beneath the surface: chronic inflammation, stress, and lifestyle habits that quietly damage the heart every single day. And while doctors focus on medications, very few talk about the number one risk factor that keeps your heart at risk. Today, we're uncovering what really drives heart attack risk factors, the truth that most cardiologists never discuss, and how understanding it might just save your life. Every 40 seconds, someone in the United States has a heart attack. And yet most people still don't truly understand what is the reason of heart attack. According to the Centers for Disease Control and the American Heart Association, heart disease remains the leading cause of death worldwide, taking more than 18 million lives each year. But despite billions spent on medication, surgeries, and cholesterol-lowering drugs, the real causes of heart attack often remain hidden in plain sight. Cardiologists around the world now agree that it's not only about blocked arteries or high cholesterol, but a deeper problem: chronic inflammation that weakens your artery walls and turns small plaques into deadly ruptures. This is the number one heart attack risk factor most cardiologists never discuss. Because it doesn't show up on your usual blood test. Inflammation, triggered by stress, poor diet, smoking, and lack of sleep, silently damages your blood vessels for years before the first symptom appears. And when that fragile plaque finally bursts, it sets off a chain reaction, a sudden blockage, a starving heart muscle, and sometimes, no second chance. That's why understanding the real causes of heart attack isn't just science, it's survival. When you ask what is the reason of heart attack, most people instantly think of cholesterol. But modern cardiology reveals a more complex truth. The number one risk factor cardiologists never discuss is chronic inflammation, the silent trigger that slowly erodes the lining of your arteries. This inflammation doesn't come from one cause alone. It builds up from years of stress, poor sleep, sugar-heavy diets, smoking, and exposure to pollution inside your arteries. This constant inflammation weakens the protective layer that covers fatty plaques. When that thin cap ruptures, the body rushes to repair it by forming a blood clot, and that clot can completely block the blood flow to your heart. That's the moment a heart attack begins. So while cholesterol plays a role, it's not the sole villain. The real causes of heart attack are a combination of metabolic chaos and vascular injury. High cholesterol and heart attack are connected because LDL cholesterol, when oxidized, becomes sticky and inflammatory. It clings to damaged artery walls, creating plaque that narrows the vessel. But here's the twist: not everyone with high cholesterol has a heart attack. And not everyone with normal cholesterol is safe. That's because inflammation, blood pressure, and lifestyle choices determine how dangerous that cholesterol becomes. Stress hormones like cortisol and adrenaline raise your heart rate and blood pressure, adding strain that makes arterial plaques more likely to rupture. Meanwhile, insulin resistance from a poor diet or diabetes feeds this inflammation cycle. These are the hidden heart attack risk factors that no routine blood test can fully reveal. Understanding them changes everything. It means prevention isn't just about lowering cholesterol, it's about calming the storm inside your arteries. And that storm begins with lifestyle. Smoking constricts vessels and accelerates plaque buildup. A diet high in trans fats and refined sugar spikes inflammation. Sedentary habits slow blood circulation and weaken your heart muscle. On the other hand, simple choices, daily movement, fiber-rich foods, managing stress, can drastically reduce your overall risk. The latest AHA guidelines emphasize that early lifestyle change can prevent more deaths than any single drug. So the causes of heart attack are not destiny, they're signals. They tell us that heart health is built day by day, choice by choice, heartbeat by heartbeat. Knowing the heart attack risk factors is powerful. But knowledge alone doesn't save lives, transformation does. Once you understand what is the reason of heart attack, you begin to see that prevention is not about fear. It's about taking back control. The moment you realize that every heartbeat is shaped by the choices you make, how you eat, how you move, how you handle stress, you start shifting from surviving to thriving. You don't have to be a cardiologist to protect your heart. You just have to become the kind of person who listens when the body whispers instead of waiting until it screams. Because heart disease doesn't begin with pain. It begins with habits, with every skipped workout, every late night meal, every breath held in stress. But here's the truth. The same habits that harm you can also heal you. Your arteries can calm, inflammation can fade, and risk can drop dramatically when you commit to small, consistent changes. This is the real path toward how to prevent heart attack by reducing stress. Eating whole foods, moving daily, sleeping deeply, and nurturing peace within your own system. Science proves that when inflammation drops, so does the danger of a heart attack. So this isn't just about living longer, it's about living better. With energy, clarity, and freedom. Prevention is not a punishment, it's empowerment, the daily act of saying yes to life. Yes to strength. Yes to your heart's second chance. So now you know what is the reason of heart attack. And you've seen that the true danger isn't just high cholesterol. It's the quiet damage happening inside your arteries every single day. The causes of heart attack are real, but they're not permanent. Your heart is capable of healing if you give it the chance. The next step is not just learning more, it's doing more. If you're ready to take action, to truly understand how to prevent heart attack and protect yourself from the inside out, then don't stop here. Watch our next video where we reveal the science-backed steps that help reduce inflammation, strengthen your arteries, and lower your heart attack risk factors naturally. Because knowledge only matters when it turns into action, and your heart deserves that chance. Subscribe to the Cardiac Hub, where knowledge meets action, and where every video brings you closer to a stronger, healthier life.